Good morning and welcome back. Well, falls are the leading cause of injury in older adults, and they can also have lasting intangible effects. And joining us this morning from Gunderson Health System to discuss falls and prevention is Injury Prevention Coordinator Kim Lombard. Kim, thanks for joining us this morning. We're talking about the Stepping On Falls Prevention Program. What is that exactly?
Well, Stepping On is a fall prevention program. It's a 7-week program that aids people in fall prevention. So each week we cover different topics, different sessions. We bring in different presenters and really talk about all the reasons why we fall. And there are many, many, many reasons. So we like to help people and assist them with preventing future falls.
Can you give us a little of the specifics? What are some of the more common reasons that are addressed, and some of the prevention practices to keeping people safe?
Sure. So if you may have heard the term, if you don't use it, you lose it. So that really goes into strength and balance. So if people aren't really being active, if they're not increasing their strength and their balance, that can definitely cause a fall. So that's one of the things we do in a Stepping On program, is practice a series of exercises to help them with that. Also, many times when people fall, it occurs in their home. So we want to make sure the home environment is safe, so we take some time to spend talking about how to do that for them. Vision, medications, there are so many different reasons why falls occur, and so we bring in like a vision specialist, a pharmacist, to help them review medications, talk about why it's important to get your vision checked yearly, and really get in depth and have some discussion around that topic.
And going back to the exercise, that seems just vitally important because from what I've read here, that people who may have a fall then think, well, I can't, exercise, or I don't want to do physical activity. That's that intangible effect of a fall.
So yeah, it kind of leads into this fear of falling if you've had a fall. And sometimes we think, well, falls is just a natural part of aging. It just happens as we get older, and that's so untrue. You can definitely combat that. You can do specific strategies and therapies to reduce that from happening. So it's definitely important to keep up on your strength and balance, whether it's the Stepping On program or another strength and balance program that you find in the community. It's super, super important.
And with regard to the actual injury, just how bad can a fall be?
Well, falls can lead to bones breaking. They can lead to hospital stays, nursing home stays, sometimes, unfortunately, even death. And when that occurs, people might happen to lose their mobility. Again, that fear of falling, having a second fall can occur. And sometimes you kind of just see their health really kind of dwindle away after that fall occurrence. So it's super, super important to add that prevention into your lives, to be aware that you can make action to reduce those chances of falling. And one way to do that is the Stepping On program.
Yeah, if you're wondering for where a good place to start might be, that just might be the place to look. All right, Kim, thank you so much for joining us this morning.
Thanks a lot.
And we'll head to break with a look at what's coming up on Good Morning America.